As she said, I'm Michelle O'Brien. I think my bio is in there, so I'm not going to go through everything, but one of the things to know about me is I've done a lot of different things, but all of it has been around mental health and substance use. I'm a lawyer. I started my career as a prosecutor for 16 years. I then worked with trial court administration and running treatment courts, and then I was executive director of the Illinois Center of Excellence for Behavioral Health and Justice. I work with SAMHSA, BJA. I'm a federal peer reviewer. I am trained in trauma-informed training for the courts, all kinds of fun stuff. I've done competency as a prosecutor, involuntary commitment, not guilty by reason of insanity. These things, I got tired of seeing the same people over and over, and it was simply because they had a mental illness or substance use disorder. And there has to be a better way to do it. We are getting better, but we have a long ways to go. So I focus at the National Center for State Courts on systems improvement, and I say systems because we cannot do this alone. We have to do this together, and behavioral health. So those are my focus areas. So one of the things I've been doing for a very long time is mapping and different types of mapping from sequential intercept model upstream with child welfare and juvenile justice. I've developed some guardianship stuff. And we also are piloting a funding and behavioral health mapping as well, because it's really important, I think, for all of our stakeholders to understand how behavioral health is funded in our states. So anyway, so with that, we are looking, part of the grant that Lori mentioned is to roll out sequential intercept mapping in Iowa. And we're going to start with a few sites, and I just wanted to give you a little bit of a background with it and kind of go for there. How many of you have heard the sequential intercept model prior to yesterday? How many of you have actually been involved in a sequential intercept model mapping workshop? Okay. Was it here in Iowa? What county? Quad Cities? Quite a few years ago? So you already know me. Excellent. Where else? And that one just happened recently, correct? Okay, excellent. So the goal of this is really to provide that overview, how it's going to be rolled out. I'm also going to be talking not only about the sequential intercept model, but about leading change. Because if we don't have the right leaders involved with this, this becomes a mapping workshop with a report that sits on the shelf. And that doesn't make any change, that doesn't implement any new programs, and so there's work that needs to be done before and after doing a mapping workshop. So it's not just a one time and done. So some of the goals. You guys mentioned a lot of these things yesterday and was really exciting. You have to be able to identify what exists in your community, what resources you have, what opportunities or gaps you have, and what you need. You have to look at process. A lot of times looking at how people move through and where some of those sticking points are is really important as well. And so really understanding all of those. Sequential intercept model is about the adult criminal justice system and behavioral health. And so there's many things that are deflection and diversion opportunities, but they may not all be mapped within the sequential intercept workshop. So some of the goals of this is really looking at bringing the right stakeholders there, having collaboration, figuring out how to coordinate and build upon efforts that already exist, building upon the strengths of the partners that are available, and then developing and executing a vision that improves court and community response to mental health and substance use disorders. We also want to encourage through all of this, looking at policies, practices, and laws that need to be potentially updated, and thinking outside the box to think about new strategies and solutions. We often get stuck with This is how we've always done it. I have never accepted that answer, and we'll have conversations about that. So this is a little bit about what some of the considerations are for the sequential intercept model, and to really, I can't see that on my computer. So how to get started. There's going to be a planning team, a small planning team. We're going to work with them about how to get the right stakeholders to attend, making sure that different branches of government are involved. And so if this is involved in a county, there should be a judicial leadership. There should be county government. A lot of times county government will end up funding some initiatives. And also making sure you have all the community and stakeholders across the sequential intercept model. Making sure that you're convening all the right collaborators and stakeholders. You also, before you can have some really good conversations, have to understand what your local landscape looks like. And so using data to help level set and have those conversations. So we'll be working with the local communities of trying to gather some of that data. Then not only is it looking at all the things you don't have, but also identifying priorities and how to do that, and action planning. So taking a few of those top priorities that you agree on, and then planning about how to move them forward. So when you leave, you will have a start of an action plan, because in 1 to 2 days, we cannot do a really detailed action plan for you. However, you're going to have it started, and you're going to have the people and the knowledge about how to keep moving that forward. There also has to be some really good discussions about sustaining. And so thinking about how you're going to keep the effort and the momentum, and how to actually implement some of the things that you guys have talked about. So after all of that, this is what the sequential intercept model looks like. This is the newest version of it. SIM was developed through SAMHSA and the Policy Research Associates as a conceptual model to inform community-based responses to involvement of people with mental illness and substance use disorders in the criminal justice system. SIM is used as a planning tool with cross-systems collaboration to reduce involvement in the justice system. So what should be in the community is really important. I think that is the most important piece of this conversation. Do you have all the things that people need to thrive? And I will tell you, I can already know what probably your top 2 conversations are going to be of things that are missing. It's housing and transportation, because that's the same thing across the entire country. It is an issue, and it's particularly an issue for rural communities. And so being able to have conversations and connect you also with people across the country that are doing some really unique things is pretty exciting. There are also states that every one of their counties have done this mapping. And they're taking that, they've taken the data from all of that, they've taken the information, and it helps then inform others about what might be able to be done. SIM is most effective when it's used as that tool to bring people together and to be strategic planning. They're best accomplished by stakeholders across all 3 branches of government. It's really hard to change some of these things for long-term effect and sustainability particularly without having all the necessary people there. So you need to think about, we will be having those conversations and thinking about who from each of those intercepts should be invited to sit at the table and have the conversation, who has the knowledge. And one of the things is you're probably going to come and know a lot about 1 or 2 of the intercepts, and that's where we're going to rely on you to share the information. And then the rest of it is about you also learning what's available at the other intercepts. I love these because there are a lot of aha moments. I didn't know we had that. I've never met you. And you see a lot of the networking, and it's really important. Building relationships is probably the most important thing, trusting relationships to long-term effective change. SIM helps develop a comprehensive picture about how people enter and move through the system. So not only is it about resource, but it's about process. And at the end of it, you'll get a graphic, and a report that summarizes all of these things. Even though you might be action planning a few things, all of those things will be recorded within this report so they don't go away. Sometimes we have stakeholders that say, well, why should I care about what's in the community? And I'm like, this is a really easy answer. If I'm a judge and I have someone that appears before me with mental illness, and I don't know what resources are available in the community, what treatment resources, housing, any of the things that this person needs, I am not able to divert somebody. And if those things don't exist in my community, I should be having conversations with those who can develop them. And so this is a partnership. This is a collaboration to ensure that what we need exists for people to be able to thrive in our communities, to not have to enter our systems to get the help that they need. I will never forget, as a prosecutor, decades ago, we won't say how long ago, we started the first mental health court in my state. And I had a 70-year-old man that had the article from the paper chase me down the hallway of the courthouse and say, I want my son in this. And I said, okay, we'll have him arrested and we'll help him. But that's where we were at the time, right? Why should people have to be arrested to get the help they need? And it's come a long way, but there still is some of that, right? We can't get people into what they need without being arrested. And so we have to keep working to make these improvements. There are some overarching, there's some, at each of these, there's evidence-based practices. I'm not going to go through all of them. You can look up the Sequential Intercept model online. You can see what some of these evidence-based practices are. There's also best practices. There's also things that have started. I know in Missouri, they've mapped every one of their counties, and they have a rural community that has a tiny home village. And they have all the supports that are 24/7, not necessarily on site, but available 24/7 for someone to call. And the change has been fabulous, and people are getting what they need to be able to live in this community and support each other. And so I think there's some really good examples out there of things to think out of the box to do. There are also several things here that are best practices across all the intercepts. And so thinking about these, just making sure there's linkage to benefits. I was sitting here listening yesterday, and I asked, and I should have known this, but I said, just to make sure, are you guys, when someone's in custody, is it a termination state or a suspension state for Medicaid? Yeah, and that's important. But there's, making sure that you have the best law that looks at that to make sure it's the easiest way to get those things turned back on when someone is getting ready to leave. And there's some states that you can even turn it on prior to them leaving so those connections can be made. And just making sure linkages are available to benefits and other things, that there's cross-system collaboration, routine identification of people with mental illness and substance use disorders, making sure that people are being screened at all the right points and early on, making sure there's access to treatment from many different places, and that there's information and data sharing. I love the conversation about HIPAA yesterday. It is a crutch, it is a barrier, and it's being used by agencies and organizations, and it was enacted to protect the individual, not the organization. And so we have to, as an attorney, we have to have different conversations about that, because I think when it came out, we jumped on it really fast, and it got down the wrong road. So having those conversations about how can we share this relevant information across different stakeholders and try to make better decisions. So I also want to make sure that we don't forget this in this whole conversation, the concept of social determinants of health and thinking about what people need to be successful in their communities. Hopefully everyone's heard of social determinants of health, but this is very important, how people can thrive. And we often have communities that are underserved. It's difficult. Rural communities, let me take veteran services. They're often one every 3 counties. It's hard to get to, it's a couple hours. My career was in Rockford, Illinois, and my veteran services was in Wisconsin. And so how do you best do that? And so thinking about really what people need in their communities and how to get to it. I love some of the conversations about churches helping, about different places. I just learned one about transportation where it's a volunteer transportation where they get paid for mileage. And you have volunteers that are taking people. It's in a rural community, fabulous, right? But we don't talk about a lot of that, right? We're still stuck in that public transportation or different things that just aren't really realistic in some communities. So leading change. Leading change was developed through the Conference of Chief Justices and Conference of State Court Administrators, which every state has one of those, and with the National Center for State Courts helped support that task force that was developed of how to examine courts' responses to mental illness. And leading change was developed because judges need to be a part of this effort. And one of the recommendations is that judges need to lead this. We know that there's a black robe effect that's positive in a treatment court. If we spend time talking to people, AOT was talking about this. When you have that conversation with someone, you care about them, you ask how they're doing, what we can do to help you, people actually engage. Black robe actually helps all of the stakeholders as well, all of you to show up. When the judge invites you, you're more likely to show up. If I would have called it as a prosecutor, no one would have showed up, no one would have cared. And that's okay. But you have to know where your strengths are. You have to know who should be on that planning committee and where those invitations need to come out from. And so we developed this leading change guide, and it's not just for criminal cases, though. One of the things in systems improvement is you have to break down the silos between systems. And so breaking down the silos between justice and behavioral health is crucial. But I'm also talking to judges about we have to break down silos in our courts. We are very specialized within courts. And the best example I'll give you is not mental health. It's orders of protection. In my state, I can get an order of protection in at least 5 different ways in multiple different types of courtrooms. In a child custody case, a divorce case, a criminal case, just an emergency order of protection. And if they're not coordinated, think how confusing that is for the person. And so we have to do a better job of informing each other of what we are doing and how to make it easy for someone to navigate our system and to get through our system. There's a lot of times that people might be involved in eviction court, criminal justice court, and a family, child welfare court. And it's really important to make sure those things are connected. So breaking down silos is very important. So this QR code will get you to this. It's also on ncsc.org/behavioral health. The task force developed over 100 resources as part of this 2.5-year task force, from competencies to civil commitment to systems improvement work. But there's a leading change guide for state court leaders and trial court leaders, so local leaders. This was developed in conjunction with the leading change guide with Sequential Intercept model, but we built on it because Sequential Intercept is focused on such a narrow point that we wanted to make sure it applied to all courts, different areas, and you'll see in that trial court guide, there's stripes. We couldn't be creative to think about what to call them, so we called them stripes. But there's things that we added that affect not just criminal justice and behavior. Just criminal justice affected other things. Data sharing, public campaigns. So people understand, someone talked about 988, 211, do our communities even know what those are? There has to be coordinated court and community responses, so it talks about that. There's some others in here that talk about every court leader should know. There's actually some competency things in here as well, guides and toolkits about how to bring people together, the questions you should be asking, and how to move that forward. The other thing is at the end of this is the report and recommendations. There were 11, there were many recommendations that were made, but they were organized in these 4 areas that judges should lead, they should examine. So you have to know what exists and what the data looks like and all of those things. Then you have to educate, and then you need to advocate. And advocate became that's a sensitive word for judges, right? But there's a way to advocate for the things that you need, even as a judge. But I think this applies to everybody. We need to lead these efforts. We need to we need to examine what's going on, because if we don't, we will make the same choices and decisions, educate and advocate. So we also have box hubs that you can see. We have a listserv. I know that Dr. Hess and I talked about this yesterday. We have a listserv that goes out 2 times a month, and they are resources from local communities to other state and national organizations, and webinars and all different sorts of things that are there. So I'm going to be around all morning if you guys have questions, and I'm here to help you. And I'll be here for however long the grant lasts. I'm not quite sure yet. Thank you so much for your time, and look forward to working with you later this morning.
Okay, my turn. So a lot of what I'm going to talk about too kind of bounces off a little bit of what Michelle said too, but it's primarily how do we roll this out into Iowa. And so as the statewide behavioral health manager, this position I think I shared yesterday is pretty new to Iowa. It's not new necessarily to across the country there. There's 20 of us now, state court behavioral health administrators. It's probably one of the most amazing group of people that I've been a part of, and I think really we have Michelle to thank for that, because she leads our, what did we call ourselves, a council? Coalition? National Council of State Court Behavioral Health Administrators. So we convened in Chicago just a few months ago and kind of really got into the weeds of it and figured out, what is our purpose here? How do we organize ourselves in a more formal manner? And this is a group of people that we really learn from each other, and it's not reinventing the wheel. So things that are happening in other states, we share these resources, we talk continually. So my role in this grant is really trying to find ways that I can help better support our courts so that they can be more involved with those individuals that have mental health and substance use disorder issues and have justice involvement. So a better way that we can respond to those individuals. This year, when I first got hired in this position, the first thing that I remember during an interview is, it wasn't Kathy, but it was Ross who shared that this is a marathon, it's not a sprint. And I have little legs, so I'm really trying to run really fast. But this first year is really about me making connections and just taking a step back and listening and learning, because my role prior to this was really substance use, like I'd shared over at HHS and my Magellan days, and it's been a new experience trying to understand the court system, and again, not those treatment facility clinical services, but more those kind of preventative diversion kinds of services that are in place. So even though I'm a resource to the court and part of it is providing them technical assistance, I really want to be a partner with everybody else. I feel like I have really good relations with a lot of our behavioral health providers in the area, and I want to continue those relationships and continue to make those stronger between the judicial branch, the executive branch, and our provider world. So that's a little bit about me. So what am I do? Sorry. There we go. Those of you that know me, I like humor. So we're going to start with Schitt's Creek. Anybody fans of Schitt's Creek? Oh, thank God. Okay. So thinking about this is just sometimes how our collaborations have felt in the past. And many of you, this is a pretty famous part of Schitt's Creek, so many of you are probably aware of this.
thin strings. Thin string blend it really well. And you'll burn it. David, that's not right.
Well, that's because I'm ladling and stirring at the same time and you're just standing there.
Now's not the time for this focus, darling.
This was your idea. You're the one who allegedly made the enchiladas.
Yes, so try to keep up. Okay, next. Now's the time to sprinkle in the chili pepper flakes.
We've already done that.
Well, now who are we on?
Oh my god, is this not your mother's recipe?
Yes, and now I'm passing it on to you. So try to keep up. Next step is to fold in the cheese.
What does that mean? What does folding the cheese mean?
You fold it in.
I understand that, but how do you fold it? Do you fold it in half like a piece of paper and drop it in the pot, or what do you do?
And I cannot show you everything.
Okay, well, can you show me one thing?
It's what you do. You just fold it in.
Okay, I don't know how to fold broken cheese like that.
I don't know how to be any clearer. You take that thing that's in your hand, and you...
If you say fold in one more time.
Yes, fold it in.
This is your recipe. You fold in the cheese then.
Don't you dare.
You fold it in.
David! Oh, good. Now I see bubbles. David, what does burning smell like?
How many remember that scene? Yeah, how many have felt that scene? Especially when we're gathering together, we're excited, we're going to be meeting with our colleagues and new people, and then you get there and there's this disappointment because we're not speaking the same language. And I know that fold in the cheese, we all have heard the expression, but then when we really get down to it, we're like, what the heck does that even actually mean? So when we get to these concepts and learning these new languages too, it's kind of trying to figure out how do we speak that same language? How do we have these clear directions and guidance? And that's what the SIM process really does. It really lays out this kind of foundation so that everybody's on the same page with everything so that there's not confusion. So hopefully we don't have any Schitt's Creek's SIM projects going on here. Okay. We won't fold in anything. We might have cookies. I hear Leslie makes some amazing cookies. Maybe she'll bring those. Okay. No. There. All right. So some of the things here, the common language, again, like I shared, having this common language across all sectors. So across the courts, across HHS, the provider world, so that we're all speaking that same framework. Every community has their strengths to build upon the gaps to address the areas of concerns that we've got. The SIM mapping really just kind of lays out clearly so that we all know where we're strong and where we're falling short on these things. No size fits all. Every district, obviously, every community and counties have their own issues, their own gaps to build upon. So that SIM mapping, again, lays out clearly so what we all know where we're falling short and where our strengths are. I passed up some of those. This is hard to read. Okay. So why does Iowa need the SIMs? Some of the information that I brought up here just kind of alludes to why it's so important to bring the SIM mapping and the model here to Iowa. The overrepresentation that we have in our justice system, this tells us that our jails have really become the de facto for our treatment centers. We have nearly half of Iowans that are in jail living with a mental illness, so it's so important that we try to fix that system and try to be preventative so that we're diverting those individuals from the jails and getting the help and supports that they need in their communities. Let's see, I'm going to kind of pass through some of these just for time. Now, when I do that, it's not, oh, it is bringing it up. I'm sorry, you guys. I'm blind. Okay. These are just some statistics that I found. So approximately half of individuals in Iowa's jails do have a mental illness. Mental health services are often inadequate, with some jails not providing basic mental health treatment beyond medication, confirmation, and management. And then inadequate mental health services contribute to overrepresentation of mentally ill individuals in correctional facilities, with 10 times more individuals with an SMI in prisons and jails than in state mental hospitals. And Iowa only has about 2 psychiatric beds per 100,000 people, and Iowa ranks the lowest in the nation for this, according to the Treatment Advocacy Center. So again, this really underscores the justice system's role as a default mental health provider. These statistics highlight the urgent need for improved mental health services and support for incarcerated individuals with mental health. Across Iowa, we're seeing rising behavioral health needs show up everywhere: our criminal cases, our juvenile court, and our civil commitment dockets. What's available in one district may be completely absent in another. Some have our crisis teams, treatment beds, while others rely entirely upon our jails. That SIM mapping really helps highlight the differences so we can plan accordingly and realistically. Everyone's feeling it. The judges managing overloaded dockets, the clerks processing complex cases, attorneys trying to navigate scarce services and resources, HHS staff fielding gaps, and law enforcement managing the crises on the streets. So SIM is that shared roadmap for courts and the communities. The power of SIM is that it pulls us all together around one map. It creates a shared roadmap for those courts and communities so we all have a coordinated path forward. So Iowa, what we're going to be doing, this is a year-long initiative by the judicial branch with some partners. The workshops that we're hoping to roll out in the next year, we're going to try to impact all of the 8 judicial districts as best that we can. The participants, like Michelle had stated, we're going to be looking at a wide variety of folks to come to the table. So the courts, the judges, clerks, HHS, law enforcement providers, advocates, lived experiences that we also want at the table as they're a vital component to this. And as Michelle asked, there's been some previous SIM workshops that have already been conducted here in Iowa, Michelle being part of that. I think you said 10 years ago in the Quad Cities, been a while. So may need to revisit that because a lot of things have shifted and changed in 10 years. Polk County had one back in May of 2023. Did anybody from Polk County? Okay, there are a few of you. Yep, Kelly. And then the Johnson County one that was done back in April of this year. So the timeline that we're hoping to roll this out, so probably on Monday I'll be in contact with Michelle. We've already kind of been working on the early planning stages of this, but it's going to be moving pretty quick. So right now we're going to really look at trying to kind of do more of the planning around the piloting of this, and hopefully in December we're going to be able to pilot our very first workshop here in the state. We're still trying to kind of figure out the logistics of where, who, and all of that planning process, so we're not sure of where we're going to be doing that quite yet. And then next year in the spring, early summer, we're hoping to expand that to other districts as well too. Part of the planning is really, we're going to be working pretty closely with Michelle and her colleague at National Center for State Courts on training facilitators to be able to go to multiple districts so that we can have the same facilitators to go out and provide these SIM workshops. And then hopefully next year, once we've had a few of these, we can look more at a statewide, what is the trends, what are the goals. We're gonna, like Michelle had shared, that there's a report that's extremely, if any of you guys have seen those reports, you can find them if you just Google like SIM workshops. I think the Polk County one's out there. I'm not sure if the Johnson County one's out there yet publicly, but it's very detailed and it's got tons of information. It's very well organized. So we'll be able to kind of draw from that and looking at all of the districts as a whole too. What are the similarities? Are there some things that we can kind of tackle from the judicial side and to support to try to make improvements? The format for the workshops, so these will be a day and a half to 2 days facilitated sessions that we have for these SIM workshops. We'll again be reviewing the intercepts, the 0 through 5, looking at how people with those needs flow through the system in your counties and districts. We don't just talk about the problems, we identify the strengths we can build on, the gaps that need to be filled, and the priorities that rise to the top. And then really convert those into action steps. And at the end, we'll be able to leave with a clear set of local action steps and recommendations that's concrete and actionable. I kind of see it as a treatment plan. So for the court purposes, the positives for this, the biggest outcomes that the courts go and walk away with is a practical bench-ready action plans, so they can actually use these, not just in theory. The judges and attorneys are seeing more cases tied to competency and mental health. SIM gives courts clearer pathways to handle those cases more effectively. So by mapping intercepts, we identify the diversion points, options besides jails or unnecessary civil commitment, so people get the treatment, not the custody. And the process strengthens ties between the bench and the community providers, making the handoff smoother and services more accessible. And finally, SIM creates a foundation for consistent statewide coordination. Local plans connect to bigger roadmaps, so we're not reinventing the wheel in each district. Supports and partners, like I said, NCSC has been absolutely amazing. I can't imagine doing this work without Michelle and her guidance and leadership. The local HHS partnership that we have, providers are amazing, outstanding. I'm always advocating for providers. They just do so much good work in our communities, and they get so many times unrecognized for that. Law enforcement, lived experiences. This really only works if we're all doing it together and coming together. So the call to action, judges and clerks are central to this work. Judges' participation matters. As Michelle said, the black robe approach, so when a judge calls the meeting, people just really show up to those. So we also want them not just to be showing up, but listening, and not just listening, but being leaders that can convene and move those local systems forward. We also will need those providers, you guys, the law enforcement, hospitals, advocates, other community partners to bring their ideas and their resources to the table, knowing the challenges that, because they're on the ground working that every day, we need to know from them what's working and what isn't working. And lastly, building this together. So SIM is about adopting everyone's resources and coming together as a whole, building an Iowa-specific path forward, district by district, so solutions fit our courts, our communities, and those that we serve. Okay, so we just have a couple minutes. Is there any questions that you guys have that we can answer before we move into the next session? What we're going to do too is after Dr. Hess and Dr. Clemens, we're going to, like I said, move into the action portion of the conference. But what we would like to do, it's kind of what I call a mini sim. So it's just, we're going to be talking about, we'll give you some directions, but we're really going to get into those districts and talk about the pre-planning of kind of a sim, and what are the things that, whether you heard from yesterday or even today, things that are kind of make you excited, things that you can think about bringing back to your communities. And these don't have to be big, huge things, you know, that you're undertakings. It can just be a matter of how we want to get the word out more about 988. I hear a lot of people that don't even understand that, don't even know that that exists. So even if it's just that piece, or just reaching across, you know, to our neighbors, working with law enforcement, wanting to do a ride-along, learning about, I think Margaret talked about the crisis intervention team and being able to experience that. Courtney was talking about from the competency, or from, what was Courtney's, the mental health court, being a part of that and observing some of those as well too. So even just reaching out, if they're just these small goals that you want to do, just to learn more about the programs that may not exist in your communities. Okay, we're still needing coffee. Okay, well, we will go ahead and introduce the next speakers. You gonna help me move this? Thank you. Just while you're getting that ready. Sorry. Okay, I will